Welcome back to the channel. I'm Chris, physiotherapy student. Today's topic is principles and methods of musculoskeletal assessment. A fundamental requisite to the study of evaluation of joint range of motion and muscle strength is the knowledge of evaluation principles and methodology. We'll discuss the factors pertinent to the evaluation of range and strength. A firm foundation in the principles, methods, and associated terminology presented is necessary knowledge for the specific techniques presented in other chapters. Communication. When conducting a physical assessment, explain to the patient the rationale for performing the physical assessment and the component parts of the assessment process as these are carried out. When communicating with the patient, do speak slowly, use layman terms, provide concise and easily understood explanations, encourage the patient to ask questions at any time, confirm with the patient that she or he understands what is being communicated. It is essential that the patient understands the need of the following: expose specific regions of the body and assume different body positions for the examination, and communicate any change in their signs and symptoms during and after the examination procedures. Inform the patient that he or she might experience a temporary increase in symptoms following an assessment, but the symptoms should be subsided within a short period of time. Visual observation. Visual observation is an integral part of assessment of joint range of motion and muscle strength. The body part being assessed should be adequately exposed for visual inspection. Throughout the initial assessment of the patient, the therapist gathers visual information that contributes to formulating an appropriate assessment plan and determining the patient's problems. Information gained from visual observation includes facial expression, body posture, symmetrical or compensatory motion in functional activities, muscle contours, body proportions, and color, condition, and creases of the skin. Palpation is the examination of the body surface by touch. Palpation is performed to assess bony and soft tissue contours, soft tissue consistency, and skin temperature and texture. Visual observation and palpation are used to visualize the deep anatomy. Palpation is an essential skill to assess and treat the patient. Proficiency at palpation is necessary to perform the following: locate anatomical landmarks needed to align a goniometer, tape measure, or inclinometer correctly when assessing joint range of motion. Locate bony segments that make up a joint so that one joint surface can be stabilized and the opposing joint surface can be moved to isolate movement at a joint when assessing joint range of motion or mobilizing a joint. Locate bony anatomical landmarks that are used to reference points to assess limb or trunk circumference. Determine the presence or absence of muscle contraction when assessing strength or conducting re-education exercises. Identify bony or soft tissue irregularities. Localize structures that require direct treatment. Proficiency at palpation is gained through practice and experience. Practice palpation on as many subjects as possible to become familiar with individual variations in human anatomy. Palpation technique. Ensure that the patient is made comfortable and kept warm, and the body or body part is well supported to relax the muscles. This allows palpation of deep or inert structures such as ligaments and bursae. Visually observe the area to be palpated and note any deformity or abnormality. Palpate with the pads of the index fingers and the middle fingers. Keep fingernails short. Place fingers in direct contact with the skin. Palpation should not be attempted through clothing. Use a sensitive but firm touch to instill a feeling of security. Prodding is uncomfortable and may elicit tension in the muscles that can make it difficult to palpate deep structures. Instruct the patient to contract a muscle isometrically against resistance and then relax the muscle to palpate muscles and tendons. Palpate the muscle or tendon during contraction and relaxation. Place the tips of the index and middle fingers across the long axis of the tendon and gently roll forward and backward across the tendon to palpate the tendon. Therapist posture. Apply biomechanical principles of posture and lifting when performing assessment techniques. Therapist posture and support of the patient's limb are described. Posture. Stand with your head and trunk upright. Feet shoulder width apart and knees slightly flexed. With one foot ahead of the others, the stance is in line with the direction of movement. Maintain a broad base of support to attain balance and allow effective weight shifting from one leg to the other. When performing movements that are parallel to the side of the plinth, stand beside the plinth with the leg furthest from the plinth ahead of the other leg. When performing movements that are perpendicular to the side of the plinth, face the plinth with one foot slightly in front of the other. When performing movements that are diagonal, adopt a stance that is in line with the diagonal movement, with one foot slightly ahead of the other. Protect your lumbar spine by assuming a neutral lordotic posture, and avoid extreme spinal flexion or extension. Gain additional protection by doing the following: keep as close to the patient as possible. Avoid spinal rotation by moving the feet and turn. Using your leg muscles to perform the work by flexing or extending the joints of the lower extremity. Adjust the height of the plinth to assume a neutral lordotic posture. Keep close to the patient and avoid fatigue. Supporting the patient's limb. To move a limb or limb segment easily, perform the following: support the part at the level of its center of gravity, located approximately at the junction of the upper and middle third of the segment. Use a relaxed hand grip, with the hand conforming to the contour of the part, and support or lift the body part. Give additional support by cradling the part with the forearm. Ensure that all joints are adequately supported when lifting or moving a limb or limb segment. This is all on the topic of introduction to principles and methods of musculoskeletal assessment. I'm Chris. Thank you for listening.